All new on the Doctors.
Doctor, give me the news.
So today we're very lucky to be joined by a specialist in the field of neuroscience. She's from the Cerebral Cortex Institute. Please give a warm round of applause for Dr. Brown Sicard. Hi doctor, how are you doing today?
Good doctor, how are you?
I'm very good. So could you please explain to us what these upper motor neuron tracts look like, where they are, and some of the functions?
Yeah, so if you'll put up my slide here. So as you can see, we have two parts, the medial upper motor neurons and the lateral upper motor neurons. So first I'll talk about the medial. There are four parts to this tract, and it controls our posture and our gross movements, and also our involuntary movements. So when I hear a loud noise behind me, I turn and look. The first one is the reticulospinal tract. It coordinates our bilateral movement in limbs and muscles and helps our body to anticipate postural adjustments and reaching. So as I walk across the stage like this, my body is adjusting and I'm using that tract. The medial and lateral vestibulospinal tract involves movements and postural positions of the head and neck in response to gravity. So as I turn my head sideways like this, the tract is alerting me that I'm not right with the world and I need to move my head. The medial corticospinal tract controls the neck, shoulder, and trunk muscles. So when I reach up to get Dr. Travis a high five, that tract is being utilized. Also involved in our motor neurons is our lateral side. This tract is responsible for allowing us to activate individual muscles for movement and separately from the other muscles. So as I clap my hands, all my muscles are working together and I don't have to signal my thumb and fingers individually. The lateral corticospinal tract makes sure that there are no unwanted motor muscle movements by activating inhibitory neurons. So as I'm buttoning a button on a shirt or tying my pants, I'm sequencing the steps and not twitching or doing other movements. The rubrospinal tract, it's small, but it does contribute to the controlling of our upper limb distal extensor muscles. So as I raise my arm to itch my head, it's contributing to that tract. There are also cortical brainstem tracts that are involved in the upper motor neuron, and they control the muscles of the face, the tongue, and some neck muscles. They directly affect facial expression like smiling, the ability to speak and vocalize, eat, and move superficial neck muscles. Lastly but not least, there's some non-specific upper motor neurons that release serotonin and norepinephrine and generalize their effects and make it less specific movements to help contribute to our emotional motor system.
Awesome. Very interesting. So these are very involved. It's very interesting. So now, after the break, we're going to see what an injury to one of these tracts actually looks like. Coming up next on The Doctors. So welcome back. We are joined now by Dr. Homunculus. She is a world-renowned neuroscientist from the Central American Institute of Neuroscience and Upper Respiratory Infection. We are also joined by the star of our video there from sunny Alberta, Canada. We have Angela Davis with us. Thanks for being here.
Oh yeah, sure you betcha.
All right, and thank you, doctor, for being here. Now, Dr. Homunculus, could you please explain to Angela, as well as to our studio audience, just what was happening to her during her stroke?
All right. It's nice to meet you, Angela. What we were seeing during her stroke is actually somewhat of a common stroke of the medial spinocortical tract. This tract begins in the cerebral cortex and travels in the medial part of the spinal cord. This innervates the muscles in the neck and the shoulders and in the trunk also. An interruption in any of the parts of this tract in the area it travels through will result in the loss of motor control of the neck, shoulders, and trunk, which we saw by the inability to maintain your neck position, the sagging of your shoulders, and also an inability to remain upright.
Okay, so doctor, could you please go in a little more further detail on some of the upper motor neuron tracts and how they could be damaged by a stroke and how that damage would present in a patient?
Certainly, doctor. The reticulospinal tract also runs medially, but begins in the pons and ends in the cervical spinal cord. This tract also plays a part in the posture accompanied by gross motor control. Any stroke affecting this tract will result in the inability to walk, raise your arms, or move from sitting to standing. The medial vestibular tract receives information about the head movement from the vestibular apparatus located in the inner ear and uses that information to control the position of the head. It begins in the upper medulla and ends in the cervical spinal cord. The lateral vestibulospinal tract, despite its name, is still part of the medial group and follows the same pattern as the other vestibular tracts. It also plays a part in postural muscle control.
What about the lateral tracts, doctor? What are they responsible for?
The lateral corticospinal tract is responsible for fractionation, which is exactly what Dr. Brown-Secord was talking about when she clapped her hands earlier. Fractionation is the ability to activate single muscles independently of the other muscles. It is essential for fine motor movement with the hands, which includes writing, opening a soda pop, or turning on the radio. The lateral corticospinal tract begins in the cerebral cortex and ends in the cervical cord, but also exists in the sacral regions of the spinal cord. The other lateral tract, and the final of the upper motor neuron tracts, the rubrospinal, it too begins in the cerebral cortex and ends in the cervical cord. A stroke of this kind of tract would present as an incapacity to initiate extension of the wrists or fingers.
Huh, very interesting. That's all the time we have for today. I'd like to thank my guests, Dr. Homunculus, Dr. Brown-Secord, as well as our guest, Angela Davis, for being here. I'd like to thank everybody for watching today. Please join us tomorrow when we discover, is your occupational therapist really helping you?
The doctors investigate.
So now I'm joined by Janet, the mother of Susie, who's been seeing occupational therapy for a couple weeks now. So what we want to know is, are these pictures that Susie's making actually a form of therapy or just a really expensive art class?
In occupational therapy, we use arts and crafts to help improve bilateral hand
Whoa,
skills.
whoa, whoa, Picasso. Susie's not doing anything. It's just so expensive. Why pictures?
Find out on the next Doctors.